Good evening, everybody, and welcome to Fertility Talk Live. We're just going to wait for a few people to come on, and tonight's topic is recurrent miscarriages. So, hey, Family Matters, see you guys. Dr. Deo is here. So we're talking to Dr. Deo and Tebogo Deo, and she is from the Genesis Reproductive Centre. See quite a few of you guys are joining us, and while you are joining us tonight, I thought I'll just let you guys also know about we've got our first talk happening next week, Tuesday, and that's happening at the Genesis. It's a fertility support group. It's happening at Genesis Reproductive Centre in Pretoria. So I'll be in Pretoria. We've only have 15 spaces, so we've already booked 10. So if you'd like to join, please send a message. It's hot, guys. It's Cape Town. Please send me a message, DM me, so that you can book your spot, because I can only take 15. And I've got some nice gifts for you guys. I can't wait to show you. I'll post it on Monday. So whoever's going to join us, I've got some nice gifts for you guys that I will hand to you when we at the talk. The support group, and it's all anonymous. You don't have to give your name when you get there, but come and show support. Be with women that understand your journey, that's been on the journey, that's on the journey, and show your support, and also gain some support from the women that's out there. So thanks everyone for joining us. I'm just going to send Doctor an invite. So we're speaking to Dr. Deo. She is, I've sent her an invite, and now we wait. Hope it's gone through. There we go. It's gone through, and we'll just wait for it to come. Hey, hi, Doctor.
Hi, Leanne, and hi to everybody.
Hi there. Welcome, and I'm very excited to meet you in person next week, finally, Tuesday.
Yes, we can't wait to host you too. We're looking forward to you and everybody coming to join us at our clinic.
Awesome. So yeah, there's a lot of women. So you guys are also going to meet Doctor, and all the other doctors that are there as well. You get to meet them. So that will be great. So please send us a DM. Like I said, I've only got 5 spaces left. I've already booked out 10 spaces, and we're trying to keep it as small as possible, so it gives everyone a chance to, be able to have this say, and everybody to show each other support and that type of thing, and not be too big, so you don't feel too shy to actually talk and say something. So today we're talking about miscarriages, but if we can please start off and just introduce yourself and who you are and where you're from.
Hi, Leanne again, and to everybody out there. I'm Dr. Tebogo Deo. I'm a fertility and reproductive specialist. I'm based in Kloof Clinic, and we work from Genesis Reproductive Centre, that is in Pretoria East, in Pretoria. And we are
awesome.
happy to be with you. Yeah.
Awesome. Thanks, Doctor. So the first question, we're talking about miscarriages, and particularly recurrent miscarriages. So women that's had more than one. It's an important topic for me as well, because I've had quite a few. So the first question we've got on that is, what causes a miscarriage?
It's quite, the causes are vast, Leanne, especially for recurrent miscarriages. We can go, either they can be as a result of the maternal problems, or it can be as a result of the fetus that is having a problem. And then we go on to divide them as to when exactly did they happen. Was it in the first trimester, or is it further on? So if it is a fetal cause, usually it is because of genetic abnormalities that you can find in the fetus. That means there's some chromosomal abnormalities that are not compatible with life, and usually this miscarriage will happen in the first 12 weeks of pregnancy. And then further on, you can have others that are maternal, like I said, hormonal, like under or overactive thyroid. You can have conditions like diabetes, especially when it is not well controlled. You can have infections like syphilis, and quite a few viral infections. Any illnesses that causes a fever that can do that. Then you go on to have blood conditions like lupus, autoimmune conditions, antiphospholipid syndrome, that can also so these are blood conditions that causes too much clotting. Then in the uterus itself, you can have structural problems with the uterus, where there's a wall in the uterus, what we call septate uterus, and as a result of that, attachment is not so good, or you can have a weakness in the mouth of the womb, so then a person would miscarry, especially in the second trimester. Or you can have inside the womb either tumors, non-malignant, so not cancerous tumors like polyps, fibroids, and adhesions, probably from previous procedures that were done in the womb. And sometimes you actually don't have an explanation, what we call unexplained miscarriages, Leanne.
Well, so there's actually quite a lot of things that can cause it.
And this is not an extensive list, because, I mean, there's other things like obesity, lifestyle, smoking, excessive drinking, drugs, you know, so there's quite a lot of vast number of causes.
Okay, so the next question is, what could I have done differently? The reason why I asked this question, doctor, is because we as women, we tend to blame ourselves as soon as when it happens. I think so many women are probably saying yes and agreeing to it. Is we're always asking, what could I have done differently? You know, so maybe we could just answer that, even if it's not a medical side of it, and just answer it to answer the question first, please.
So, Leanne, I want to give the women this reassurance that miscarriages are very common, and a lot of times people who are not even aware that they are pregnant, there's a lot of miscarriages that happen that has got nothing to do with what you did. So people must not go actually blaming themselves a lot. But there are things that can be preventable, like making sure that you control your diabetes, making sure that you eat healthy, avoid smoking, stop drinking, lose weight. So those are the things that you can do differently. But it is quite a common phenomenon after the age of 40, up to 50% chance of having miscarriage. So if somebody like that asked me what could they do differently, obviously I would say have babies earlier, and that doesn't help you at that age, isn't it? So we just educate and figure out what is wrong and take it from there, and do not blame yourself.
Thank you, doctor. Will this happen again? You know, once you've had one miscarriage, does it mean that you're going to definitely have another one, or could it just be for that one?
So if you've had one miscarriage, there's an 80% chance you will have a healthy baby. If you've had more than two, there's a 40% chance that it will happen again, but there's a 60% chance that you will go on to have a pregnancy at term that is not related to, that does not end up in a miscarriage, depending on what the cause is. Obviously, if you are having something like a blood condition, then obviously there's a high chance that it will happen again. Or if you have a thyroid disease that is not well controlled, there's a chance that it will happen again. But there's even a higher chance that you will conceive normally if it is not one of those conditions.
Okay, great. How can I improve my chances of having a baby? Okay.
My advice would be go and see a doctor. So we should normally doing a pre-pregnancy consultation. Walk into the gynecologist and say, I am planning to have a baby, and have yourself been checked so that they can advise you on the kind of lifestyle changes you need to make. You can go through the medication that we are taking and make sure that that is all controlled. And then if you've had a miscarriage, there are blood tests that needs to be done.
I think doctors having a phone call come through. So that happens when you have a phone call. Doc, I don't think we can hear you. I think you had a phone call coming through, so we didn't hear anything you said in the last few seconds.
Oh, I'm very sorry about that. So I was saying that the main thing would be to to prepare to go and see the doctor and make sure that you advise, have an examination done, and then they can be able to tell you if you have had miscarriages before, wait until the doctor says that it is safe to do so. So go and consult and make sure. Lifestyle improvement, stop smoking, stop drinking, exercise, lose weight. And of course, control this, your mental, you must be mentally and physically prepared to go through the next pregnancy. Yeah.
Yeah. Okay. Do you recommend further testing after someone has had a miscarriage? And what is it that Genesis would do if someone's coming to them and they've dealt with a miscarriage, they've gone through a miscarriage? When do they decide to do further testing, and what type of testing is done?
So in Genesis, if you've had a second trimester miscarriage, so that means that later on, after 12 weeks, even after especially one of those painless miscarriages, we would investigate you straight away. But if this is your first miscarriage and you have not had a miscarriage before, we would probably reassure you. But having said that, we will have done history to make sure that we are not missing something, and we will have examined do a pelvic examination, do an ultrasound examination. And then based on that ultrasound examination, then we can maybe go further. If we think that there may be abnormalities of the fiber of the uterus, then we do a 3D scan. And from the 3D scan, we can be able to tell whether there's structural abnormalities. We can be able to tell whether there's growth in the uterus. And then from there, we would progress to go and do a hysteroscopy, which is a procedure where we put a camera inside the uterus and we will be able to then take care of those structural abnormalities. Not all septae or that wall in the uterus need to be operated, by the way. So that we are seeing a small indentation in the womb does not actually mean that you have to have an operation. And then we would do blood tests. So among these blood tests, I spoke about thyroid. And then if the thyroid is under or overactive, then we would have to maximize that. We'll check your sugar to make sure that you are not having diabetes or anything like that. Check for infections like syphilis. I've already mentioned those. And then lifestyle advice, of course. Then we make sure that that is well controlled. And any other medical conditions that you may have, we need to make sure that that is under control.
Okay. I've got one question here. It says, how long should I take thyroid treatment before trying to fall pregnant again?
How long?
How long should I take thyroid treatment before trying to fall pregnant again?
So we need to make sure that the thyroid is well controlled. So if she's saying thyroid, I'm not sure whether it is under or overactive, whichever one it is. We need to make sure that you are euthyroid. Euthyroid means your thyroid levels are normal. So take the treatment until you get a go-ahead from the doctor that everything is A-okay. So it's not a ballpoint. You can't say 3 months, 6 months. We can say to you, take the treatment until we test you and we say that you are fine. Now you can fall pregnant.
Okay. They've got another question, if you don't mind, doctor. She says she's 33 years old. I had an oblited ovum miscarriage July last year. Now I'm struggling to conceive again. Could there be complications?
Oh, it's not quite an easy question to answer. So I would need to know how old you are. I would need to know, because a blighted ovum, if it's age related, we may have to check that.
33.
She's 30. 33. Okay, 33 years old. All right. So, and she's saying that she's struggling to fall pregnant again?
Yes.
Okay. Yes. We need to go and look and see whether there may be any problems going on in there. What could be the cause? So it is better to go and consult, come to a fertility clinic like Genesis, where we can be able to work out and figure out what is wrong. So if you're 33 and you've been trying, you've been pregnant and now it's been a year, the best thing is to come and consult and we make sure that everything is fine.
Okay. I've got a last question, if you don't mind, doctor. It says, if you have PCOS, will miscarriage be a recurring thing? So that's quite a big one as well for me. Yeah,
actually, I didn't mention PCOS there. PCOS is also one of those conditions that is associated with miscarriages. The method, the the way in which these miscarriages is happening is not necessarily, you can't say for sure this is what's happening. But yes, people with PCOS, it is possible that you can have a miscarriage again. But fortunately, if you are being seen by a reproductive specialist, usually with the medication that we can put on to make sure that you have a healthy baby.
Okay, great. Yeah, the last question we have here is, how long should we wait before trying again after a miscarriage?
Okay, so it depends on how the miscarriage was treated. Did you treat it by just waiting conservatively, in which case we have to make sure completely that you are fine? Did you have a womb scrap, or did you take medication? So if you took pills, we have to make sure that the pregnancy test is negative, the womb is empty. We have to make sure that you are physically and emotionally ready to have another pregnancy. Okay, it is possible that you could fall pregnant within the next period, but it is best that you wait and make sure that the uterus is back to normal. And usually uterus takes about 6 weeks, and when we know that it is back to normal. So, and most people are quite ready actually in 6 weeks to fall pregnant again. So listen to your body and listen to your emotions, and only then is it safe for you to fall pregnant again.
Okay, thank you very much, Doctor, for your time. I just want to remind everyone who joined us later on, if they never heard the first part of our talk.
Yes.
And what we said is, we've got a support group happening at the Genesis Reproductive Centre next week, Tuesday. We've only got 5 spaces left. We are only allowing 15 ladies to join. It is absolutely free, no cost whatsoever. Please DM me so we can book your space for that. We'd love to have you. Dr. Deo will be there, and all the other doctors will also be there to at least greet you guys, and you can meet them. And then it will be our time to just have a talk. Come and support women that is going through this journey. And yeah, let's be there to support one another. And I hope you guys can join us next week. Thank you, Doctor.
Thank you.
We look forward to seeing you on Tuesday.
Thank you very much, and I can't wait to meet you all on Tuesday. And good night.
Okay. Thanks, good talk. Bye.
Bye.